morning, so today I will be demonstrating manual muscle testing and also range of motion exercises. So now I will be doing manual muscle testing for knee extensors grade 5 and 4. Good morning, Miss.
Good morning.
Sige, malingkod ka, Miss. Unsa di ato ni Miss?
Katrina, Eliza, and Ventura.
Ang atong birthday.
February 3, 2003.
Okay, so today, Miss, I will be performing manual muscle testing to test your muscle strength, also its ability to contract, and its resilience of muscle mass. So, kaning muscle testing, ma'am, kay basis sa need for our future interventions and treatments.
Taking of the patient's vital signs is also performed. Patient should be in a short sitting position. Place wedge or pad under the distal thigh to maintain the femur in the horizontal position. Hands rest on the table on either side of the body or may grasp the table edge. The therapist should be standing at the side of the limb to be tested, giving resistance over the anterior surface of the distal leg just above the ankle.
So, ma'am, I want you to straighten your knee. Yeah, mo-apply kog resistance, ma'am. I want you to hold it. So, don't let me bend it or push it down, ha?
The therapist now applies maximum resistance.
So, since the patient displays a grade 5 of the muscle testing, ang patient's muscles contracts against maximum resistance. So, ma'am, I want to differentiate other resistance grades. So, if grade 4, which is good, patient holds end position against strong to moderate resistance. If grade 3, which is fair, patient completes available range of motion and holds the position without resistance. For grade 2, which is poor, patient completes available range of motion, while grade 1, which is trace, contractile activity can be palpated in muscle through the tendon, but no joint movement occurs. While grade 0, there is no palpable contractile activity.
Once again, for stabilization, patient's hands may rest on the table or may grasp the table edge. Muscle contraction and other gradings are one muscle involved for knee extension would be the rectus femoris muscle. It originates at the ilium, anterior inferior iliac spine, acetabulum, the groove above, capsule of hip joint, and aponeurosis, which is the anterior part. Insertion is at the aponeurosis, the posterior part, the patella, base via quadriceps tendon, the tibial tuberosity via ligamentum patellae. This muscle is supplied by the femoral nerve L2 to L4, and its action is for knee extension.
So now, I will be performing manual muscle test for knee extensors grade 4.
Same as what was shown in grade 5, patient is still in a sitting position. The therapist is also standing at the side of the limb to be tested. The therapist then instructs the patient on what to do.
So, ma'am, I want you to straighten your knee. Yeah, mo-apply kog resistance, ma'am. I want you to hold it. So, don't let me bend it or push it down, ha?
Then the therapist applies resistance.
So, ma'am, I want to differentiate other resistance grades. So, since you display grade 4, which is good, you hold end position against strong to moderate resistance. But if you display grade 5, which is normal, you hold end position against maximal resistance. For grade 3, which is fair, you complete available range of motion and holds the position without resistance. While grade 2, which is poor, you complete available range of motion. If you were to display grade 1, which is trace, contractile activity can be palpated in muscle through the tendon, while no joint movement occurs. For grade 0, no palpable contractile activity occurs.
Once again, for patient stabilization, patient may rest hands on the bed or may grasp table edges.
Since patient displays grade 4 for manual muscle testing for the knee extensors, patient's muscles contract against strong to moderate resistance.
Muscle contraction and other gradings are another muscle for knee extension would be the vastus intermedius muscle. It originates from the femur, shaft, upper 2/3 lateral and anterior surfaces, and the intermuscular septum in the lateral portion. Its insertion is at the aponeurosis anterior forming deep quadriceps tendon, the patella, base lateral aspect, the tibia, the lateral condyle, and the tibial tuberosity via ligamentum patellae. It is supplied by the femoral nerve and its action is for knee extension.
Next would be knee flexion, lateral hamstring, grade 5 and 4.
Have the patient lie flat on her belly. Knees should be flexed to less than 90 degrees and leg is in external rotation, with toes pointing laterally. Therapist is at the side of the limb to be tested and resists knee flexion at the ankle using a downward and inward force.
So ma'am, maintain the position of your knee. Don't let me push you down, ha?
Patient's muscles contracted against maximal resistance.
Since patient displays grade 5 lateral hamstring test, her muscles contracted against maximal resistance and knee flexion position is maintained. So ma'am, I want to tell you the difference of each grade. So since grade 5 ka, your position holds end position against maximal resistance. If grade 4, it holds end position against strong to moderate resistance. For grade 3, which is fair, it completes available range of motion and holds the position without resistance, while grade 2, which is poor, completes available range of motion, and grade 1, which is trace, it displays contractile activity, can be palpated in muscle through the tendon. No joint movement occurs, while grade 0, there is no palpable contractile activity.
Once again, since patient is already in a prone position, stability is assured. Muscle contraction for other gradings are one muscle for knee flexion is the semitendinosus muscle. It originates from the ischial tuberosity, inferior medial aspect, tendon via aponeurosis shared with biceps femoris, long head. Its insertion is at the tibia, proximal shaft, the pes anserina, and the deep fascia of the leg. It is innervated by the sciatic nerve, tibial portion, and its action is for knee flexion.
Next, I will be performing manual muscle test for knee flexion, lateral hamstring, grade 4.
As shown previously, patient lies on her stomach. Have the patient's knees flexed to less than 90 degrees, leg is in external rotation with toes pointing laterally. Therapist is at the side of the limb to be tested.
Ma'am, maintain the position of your knee, ha, and don't let me push you down. Since patient displays grade 4 for lateral hamstring test, patient's muscles contract against strong to moderate resistance and knee flexion is maintained. So ma'am, I would like to differentiate other resistance grades. So for grade 5, which is normal, a resistance will be maximal and the end knee flexion position cannot be broken, which is approximately 90 degrees. For grade 3, which is fair, holds end range position but tolerates no resistance. For grade 2, which is poor, completes available range of motion in side-lying position. And for grade 1, which is trace, tendons become prominent but no visible movement occurs. And lastly, grade 0, no palpable contraction of the muscles, tendons do not stand out.
Once again, stability is assured with the patient on her prone position. Muscle contraction in other gradings are another muscle for knee flexion is the semimembranosus muscle. It originates at the ischial tuberosity and sacrotuberous ligament. Insertion is at the distal aponeurosis, the tibia in its medial condyle, the oblique popliteal ligament of the knee joint. It is innervated by the tibial part of the sciatic nerve, and its action is for knee flexion.
The first for range of motion would be knee rotation. Good morning, Miss.
Good morning.
Sige, malingkod ka, Miss. Unsa rin ato ni Miss?
Katrina Eliza and Ventura.
Ang atong birthday.
February 3, 2003.
Okay, so today, ma'am, we will be doing range of motion. So range of motion improves joint function, and it also is a basis for future interventions and treatments.
Note that we should also take patients' vital signs.
So at this time, we are not able to recommend measuring voluntary knee rotation in the clinical setting because most methods for measuring rotational laxity are still in various stages of development. The only practical method that could be used in the clinical setting is the one used by Clarkson, who measured total active tibial rotation, range of motion, with the individual in a sitting position with the knee flexed to 90 degrees. An OB Myrin compass inclinometer was strapped on the tibia, and the mean total range of motion was given as 40 degrees in women and 58 degrees in men. However, the reliability and validity of this testing method were not reported.
So the equipment used for this specific range of motion is the OB Myrin compass inclinometer. This device consists of a fluid-filled rotatable container mounted on a plate. The patient is in a sitting position with the knee flexed to 90 degrees.
So the therapist positions herself near the patient's limb to be tested, and then the therapist also rotates patient's leg to left and to right.
Doing this guides the patient to the proper movement. Patient may place hands flat on the bed for stability. Once again, the normal ranges would be 40 degrees in women and 58 degrees in men. However, the reliability and validity of this testing method were not reported.
The second for range of motion would be midtarsal eversion. So unsa rin ato ni Miss?
Katrina Eliza and Ventura.
Ang atong birthday.
February 3, 2003.
Okay, so today, ma'am, we will be doing range of motion. So range of motion improves joint function, and it also is a basis for future interventions and treatments.
We should not forget to take vital signs.
So for today, ma'am, I will be using a goniometer. A goniometer has three parts, so the fulcrum, the proximal arm, and then the distal arm. I will be using this to measure your range of motion in degrees, ma'am.
Have the patient in a sitting position with knee flexed to 90 degrees. The hip should be in 0 degrees of rotation, adduction, and abduction. The subtalar joint is placed and held in the 0 starting position so that the calcaneus is parallel to the midline of the lower leg. The therapist positions herself facing the foot of the patient while observing proper body mechanics.
So ma'am, ang atong motion, ma'am, kay paana, ma'am, ha? Bring your foot towards the side, to the right side, ma'am.
The center of the fulcrum is over the anterior aspect of the ankle, slightly distal to a point midway between the malleoli. The proximal arm is with the anterior midline, using the tibial tuberosity for reference. The distal arm is with the anterior midline of the second metatarsal.
So ma'am, at the count of 3, I want you to bring your Foot facing to the right side, ma'am, ha? 1, 2, 3. Okay, stop. Right midtarsal eversion is 15 degrees.
For midtarsal eversion, the normal end feel is firm, normal range AAOS is 15 degrees, its plane is in the frontal plane, and the axis is the anterior-posterior axis or sagittal axis.